Okay, we're back with David Leah, and he wrote this beautiful book, Through My Lens, and it's about the story. He is a evil Knievel kind of a man, and he's been through a lot, and he documented the story of the eruption of the volcanoes in Montserrat. And it's very impressive. He has beautiful photography. But, you know, David has a compelling story. He's very articulate, and I really enjoy the way he communicates, because so many people, David, they're suffering ailments, and their bodies are failing them for no reason. And, you know, as you witness people coming in and out, one lady had cancer 5 times. Yeah. She's a cancer 5 times, and the root cause was in her mouth. Exactly. And, you know, she cannot believe that she was going to eye doctors, ear, nose, and throats. They were doing CT scans, and they were missing the humongous abscesses on the teeth that were root canaled, that were infected into her brain. And she was like losing eyesight. Her face was swollen, her eye was twitching, she was having tinnitus. And then the other lady that just left, beautiful Debbie, she came all the way from above Jupiter, and she also had breast cancer, and they never connected the breast cancer to the root canals. And she felt like she was only in her 50s, and she was losing her memory and her mind. Yeah. And then we had Patty also that came, and we got all the mercury, the root canals out, and she was losing her memory. And they were not aware. Patients of mine refer them because they were like, oh, you got to go to see Dr. Cintron because, maybe you have something in the mouth that's connected to, that's causing you to forget everything. Yeah. Early dementia. So I have somebody with breast cancer, another one with 5 types of cancer, another person that, now she thought maybe the chemo caused the brain damage that she couldn't remember. And she said the next day she came, she was crying of joy because she actually felt that something was lifted out of her brain that she can think again. And I said, yeah. We got all these abscesses out of your brain, jawbone, and now the inflammation has come down. So it's so fascinating. Today I have 4 patients, all patients of mine, right? I did them maybe a year ago, and they're rejoicing now in the new stage in their lives that they're like, but we just did you 3 weeks ago.
3 weeks, and I'm looking forward to the next year to see all the different changes, because I made a list of things, I think 15, 17 things that were bothering me. I mean, just little things, but they all add up. I mean, my itchy arms, they don't itch anymore. And I had arthritis, what I thought was arthritis in my hands. I couldn't do what I usually do, play guitar or do. My dad was a magician, and I did a lot of sleight of hand. And none of these would work, and I thought, boy, I lost that ability. And now I can do all that stuff. Everything moves properly. But, just so many different things that were just bothering me. Like today I put on my pants, and before my left leg would hurt when I raised it up a little bit. And then neuropathy, and I had to balance myself on something with my hand in order to put my pants on. And today I put my pants on with just standing there,
Wow, that's huge.
And one of the tests of neuropathy is if you can stand for 15 seconds
on
one leg without falling over. And I went, wow.
So there's a lot of young people that cannot do that.
Oh, yeah.
You're in good shape.
So I'm 83, and as Dr. Cintron said, I went through a lot of different changes. And I was watching docuseries and becoming more and more and more aware of the oral health. And I knew I had a number of amalgam fillings, and I knew I had 1 or 2 root canals way back. And I ran into Dr. Cintron a year ago, and then I live in the islands 2,000 miles from here, so I didn't do anything, and then it began to bother me more, and I listened to more of the docuseries, and one of the docuseries really tuned me into the fact of there's a root cause for these things, and it could be oral. And I was diagnosed with leukemia. And
when did they diagnose you with leukemia?
April of 22, and at the VA hospital.
So that's 2 years ago.
Yeah.
Mm-hmm.
And I went back after that diagnosis, and I did a lot of juicing and fasting and enemas, coffee enemas, and consequently my white blood cell count started to go down.
Because you're helping your body get rid of the toxic
So
load.
I was still believing, in this diagnosis, but then the more I heard about the connection between the mouth and the rest of your body, I thought, I should look this up again. So I was listening to Dr. Fazio in Long Island, and I got in touch with him and said, who would you recommend in Florida? He said, just go to the site, go to this website. And I went there, and you came up again.
Oh my God, destiny.
So I said, okay, this is it. And then on her website, it said we prayerfully, do everything the way God would have us do it in our office. And that was enough for me, because I'm a believer. And I got in touch with the wonderful receptionist, Ashley. And the next thing I know, I was in here. And it was sort of a divine appointment, because first off, I got in the States. I didn't want to be here too long. And they called me the day before and said, look, we have a cancellation. The woman that was going to come in is in the hospital. Can you come in tomorrow?
That's amazing.
So that put me, the next day after I got in the country, I was in the chair, and here we found out through this cone x-ray all the incredible infection and inflammation that was in my gums.
It was very advanced. Yeah.
Very advanced.
Very advanced.
Any one of those things could have caused me
One
to have a
tooth.
big
One
problem.
tooth. Yeah. And you had 20.
20.
So it's very impressive, because, that tells the amount of health. You're very healthy. You're very strong. You're very vital. You work every day. You're working the land. You're running your business, and then for you to be able to be walking, and the left side was so infected. And what I noticed right away is, I noticed your arm and your nails, the difference between the left arm and the right. You had like a yeast infection on your skin,
all of these,
like eczema, and
this
also
one
the
got
nail.
crushed.
Yeah, so I noticed that, but I noticed all that infection on the left side, and you had like a 10-millimeter pocket on a tooth that was pussing, and it was so much infection, not only gum infection, but teeth that were open with mercury fillings, and then also abscesses on the root canals. So that tells me that for you to be alive with all those and so vital and working, you are doing everything right. Like most of my patients are people that are doing all kinds of things that are very healthy. They're eating well, organic, vegetables, exercising, they're active, they're doing hyperbaric, they're doing all kinds of very cutting edge technology, red lights and blue lights and all kinds of things. But the thing is that how can you have a dead rat in your living room and think it's not going to smell, right?
Exactly.
You have to eradicate the root cause of the problem. So, because of your medical diagnosis, we did not, hesitated and suggested all the teeth look like they're compromised and they're badly infected. And you had the courage to go ahead because, a diagnosis of leukemia is serious. And the amount of, we did blood work, and we see the blood work, the white blood cells and all that is abnormal. But everything else was good. All the levels of vitamin D, all your levels were good except that particular.
Except metal.
Right, and metal,
Heavy on the mercury.
Yeah,
and the
heavy
arsenic
metals, we
and the
did
cadmium
that.
And the aluminum and the lead and everything.
And then we're going to check it out when you come back in November. We're going to check because honestly, I see a radical change in you. Who is 83, gets 20 teeth extracted, and is healed in 3 weeks?
Praise God.
That's
It's
the hand
God.
of God.
Amen.
So, we know that we are the carpenters, right?
Yep,
But He's the healer.
exactly.
So, the fact that you believe that God is the true healer, I'm just an instrument of the Lord. And then we truly, truly pray while we're doing the procedure. We pray, you're on my prayer list. We have our patients are in our prayer list because the people that are coming are people that are mostly very ill. I have young people in their 30s, 20s with cancer.
Incredible.
And the doctors are just eradicating the organs, eradicating the breast, give them a chance. Why don't we remove the obvious and, open the pathways of healing? So, I'm so happy that you came here because you're so eloquent when you speak and your memory is sharp as a razor, because with all that metal toxicity, usually there's a decline on the the ability to communicate and also to retain information.
Yeah.
And
one of the things, Doc, that really shocked me, because I read about these kind of things, I was at a party, and there were two people next to me that I know very well, and I couldn't think of their names. And I went, no, that, and I sat there for 20 minutes, and I could not think of these two people's names.
The inflammation of the
So
infection,
there was
right?
something that just went, the bells rang.
Right, but think about it. Your teeth are connected to your maxilla and the sinus and the brain. So the roots of the teeth are 2 inches away from your brain. So if you have that infection going to your brain, it causes inflammation.
Yep,
And the inflammation is one of the causes of dementia.
exactly.
Now, when you have the root cause removed and then the inflammation disappears, then if there's no permanent damage, right, if the neurons are not damaged, that is reversible. I was reading a book with Dr. Gupta. He is a CNN correspondent doctor. He's a neurosurgeon. And he says the first easiest way to prevent dementia is by flossing your teeth. Because if
Gupta
you floss,
said that.
Gupta in his book. And then what he recommends, and my patient Patty just told me that she learned from her brain doctor that she has to floss. She didn't believe me, but now the doctor said the best way to maintain inflammation out of the brain is by flossing, because the bacteria that goes into the brain from
That's
the
amazing.
gums causes inflammation. So, reducing inflammation either by having your mouth in good shape, having your gums in healthy states, is one of the easiest way to prevent dementia.
Exactly. Well, you're watching a lot of doctors, little by little, they're changing. I hate to admit that they may have gone through medical school and not learned the root cause.
Right.
And they're just covering the symptoms.
Well, there's a separation. When I went to dental school, we do the first 2 years with the medical students. So we do all the medical courses just like the medical students. We do the pharmacology, the gross anatomy, all the different courses, but additional to that, we have the dental courses. So the workload of a dental student is, we have 11 courses. Like every 11 courses is equivalent to, I don't know how many, 30, 40 credits. It's a lot. So what happens is that when you are in medical school and you're sharing the same doctors, the same courses, there's a separation. They don't share the information. They're separate. So doctors don't think that dentists are doctors, and then they are not. They are briefly introduced to the fact that if you have gum disease, it affects your heart. So most cardiologists know that if you have gum disease, it's going to give you endocarditis and bacteremia. They know that. But do they tell their patients that they have to go to the dentist and get the gums cleaned out? No. The cardiologists that I have interviewed about why don't you tell your patients about gum disease affecting their heart, they're like, I don't have time for that. I only have 5 minutes. Now, how many hours were you here for my first visit?
The first visit, probably 2.5 hours.
Yes.
The next visit, 9 hours.
Yes.
And then it's been 2 or 3 hours every visit since.
Yeah. So that's the difference between the way I treat a patient and the way, an average dentist.
Dr. Fazio said that the first question to ask a dentist is, how many patients do you see a day? He said, if they say 15, 20, he said, run. If they say 3, 4, 5, 6, sit down and listen.
Right. Because, it's a different level of care. Totally. Like, I know what you eat, I know what you do, I know everything about you, I know your blood work, I did your blood work, I want to see your D level, I want to know your A1C, your C-reactive protein. I want to know about you because we're going to test you again. And we're going to compare, and I already know by looking at you, you look like your life was given back to you. You have color before you were gray. I've proof to it.
It's true. It's true.
So
I'm looking forward to the next 6 months.
Yes.
Even a year to watch some of this gigantic list I made of things that I know were wrong with me and I don't want to forget and say and go, oh yeah, I used to have that,
Yeah, well, immediately I see your mouth is healed. I have photos of the before and the after, and the wound is healed. You are like a 20-year-old healing, because how can you have leukemia and heal the way you healed?
Yeah, true.
It's impossible, because I have patients that have all kinds of cancers, and then I know by the way they heal, how healthy or unhealthy they are. But your jaw is completely closed for 3 weeks, and then already I see your nails. Your nails don't have that. They look like mushrooms. Yeah, see who's calling.
Nobody.
So, I'm excited to, and I'm grateful that you're sharing, because, anytime we share this kind of information, you're helping somebody.
I hope it helps hundreds.
You help somebody.
People are in the situation I was in.
Yeah.
And even most of them probably younger than myself.
Yeah.
It's going to be a big plus.
Yeah. Well, I had a patient that came with leukemia, and he found me. He came from France, and he, interestingly, he had a lot of mercury. So we got the mercury out, the root canals out, the gum. We stabilized him, and he refused chemo. He refused any medical treatment that was going to be that level, and he was young. He rode his Harley, and then suddenly he started to becoming weak and all kinds of things, and he discovered that his fiance she owned a college. So they did a lot of research, and then they came here, and, after we did all that, he started doing smoothies with a pit of avocado.
I'm doing that every day.
That's right, baby. So guess what? He's up and running. It's been over 10 years, and they cannot find the leukemia, nothing like that. But, it was a very shocking for him, because, in France, where he comes from, they use a lot of mercury. Right now I have 2 patients that are French, and they, we're getting the mercury out, the root canals out, and then one of them, has the lungs compromised, and then the other one, the heart, the blood pressure is very high, so tremendous amount of infection, So we did the wife, and now we're doing the husband. The husband, is shocked by the results that he's getting with the wife, and then, we have patients that come from, other countries, because the standard of care is different.
Yeah. Well, fortunately, my son's in the next room, and he's a pilot, and he's had a lot of trouble with his left ear, and he came to find out when he brought me here that he has a root canal on that side, and that is maybe the root of his problem, because when his immune system is a little compromised, he doesn't feel good. When he flies, this left ear always hurts him. Right.
When we did a CT scan on him, and the X-ray, and the CT scan is a 3-dimensional view, the roots are in the sinus. So the infection is in the sinus already, so it's going up it's pressed down back into the ear. So because he's a pilot, he needs to take off 10 days.
Yeah.
He cannot be flying after the extraction, because the upper teeth, they're connected to the sinus cavity. So I don't like the people to go up 40,000, feet.
Yeah.
Although I have patients that are very disobedient and they just do it. I do a surgery and then 3 days after they're up and running. But I think that why take the risk,
Yeah, exactly.
They're very busy business people. They have their own planes. They're flying their own planes. They think that because it's their own plane, it's going to be different. But it's the same amount of altitude.
Exactly.
So, but sometimes, you cannot get the compliant 100% of the patients. But my thoughts are, your business cannot be more important than your health.
Exactly.
Because your health is your wealth. If you cannot stop, do something for 2 weeks.
I was hoping to live until the election, which is just 60 days away. Mm-hmm. And now I'm thinking, my son that you're working on, he said, "Oh, Dad, you'll live to be 100." And now I'm going, you might be right now.
Yeah,
because,
definitely.
It's like being reborn again.
Yeah.
And I have you to thank and it was sort of divine the whole way it all unfolded to come and end up being here. And then having a lady cancel so that I could get in a week ahead.
What are the chances of that?
Oh my gosh, it was just
it's just God,
everything.
And we know because we know when God sends a patient. Because my prayer is, I'm only one, right? And Dr. Blvd, so we only want the patients that the Lord wants to bless and bring here, because there's a lot of people with need.
Oh, big. Everybody.
And then, we don't want to waste anybody's time. We don't want to waste our time. We want to be on purpose healing the people. And, some people have come here. I want to tell you, David, I have patients that have come here, women. I have 2 in mind. One of them, knew she was an attorney, and she had breast cancer in 2014. She knew that root canals were bad and mercury. And she said that she was so afraid of getting that out, more than having radical mastectomies.
Unbelievable.
I was like, what? That's the fear of the dentist people have.
Yeah, true.
And then we sedated her, we did the work, and because I interviewed her, I said, why did you wait so long? Why did you wait 10 years? She said, it took me getting cancer again to then eradicate the root cause.
How many doctors end up looking at the alternative things because they themselves come down with something and they knew the prescriptions they were giving weren't really fixing that problem?
We see that a lot here.
Yeah.
A lot of my patients are doctors.
Yeah.
And then they were diagnosed with autoimmune or Parkinson or something that they're not, or cancer. And they're not going to do, none of them are going to do the chemo, the radiation, none of them.
No.
So they're like, and I asked them, why are you here? David, why are you here, right? I asked him. And then, what do you think we can do? And they all said, I was diagnosed with XYZ, and I'm not going to do the treatment. I'm not going to be on this medication, that medication. I'm not going to be on steroids all my life. I'm not going to do chemo. And then they're the best referral sources because they are like, okay, I got it done. I'm up and running. I'm vital. This works. This is real. They are referring their patients.
Yeah.
But patients have to be aware that if you have metals, okay, like you had heavy metals, aluminum, lead, and mercury. Those are neurotoxins. They only not cause dementia, but they can cause neurological paresthesia, neuropathy.
Yep.
When you do chelation, when you're having a really great diet, and you're doing garlic and moringa, and you're doing, chlorella, all those things are binders. Like, then if you have the mercury in your mouth, then you're bringing it deeper into your tissues, into your skin, into your nails.
Yeah.
So people have to know that they have to detoxify first, eradicate the root cause, and then do the protocols, which are fantastic. And they have to do it slowly, because if you do too much, then you can get weak.
Exactly.
You're like, oh shoot, I'm like wiped out because you did a little bit too much.
Yeah.
So is there anything else that, you're looking forward to
I'm just
you know.
looking forward to being reborn. I mean, physically. And, I've been going to the gym and watching my son, who's into CrossFit and all that stuff.
Wow.
Going,
Well, he's 35.
Yeah. I used to weight lift and all that stuff. That's how he got into it.
Yeah.
So when I'm there seeing all these people, and I probably got 50 or 40 years on them.
Yeah.
But I find myself inspired.
Yeah.
To begin to rebuild some of the tissues that you let go just because you think, oh, I'm getting older, that's the way it is. It isn't that way.
No. I have
patients. To live much longer.
I have patients, that we have, like got their mouth out in their late 80s. Yeah. 80s, 89, 90, 93. I have patients in their late 90s. But they take care of themselves and they floss every day. Once they learn the way to do it, they're like, I don't want to lose my teeth or I don't want to lose my health. It's the Bible speaks in the book of Corinthians about, the things that are, eternal. Hope, faith, and love. Yeah. So not losing faith, and believing that, everything bad happens for a reason. I thank you for being so generous and sharing your
I thank
testimony.
you for being so generous and
Yeah.
being there to solve the problems that I was living with and really didn't even know until recently.
Yeah,
It's
and
all
you look
about
great.
the
Give me a
mind.
big smile. I love it. You can start like eating and, right now after the surgery, we had you on soft foods. But now that we got the sutures out and everything.
It'll get better every day.
Yeah, it's looking good. So thank you so much. God bless you.
God bless you, sweetheart.
All right.